Hi there, I'm Dr. Max Gatko and you're watching the Lux Dentistry channel. In this episode, we are going to cover the topic of does dental implants hurt? That's the second most common question I get after how much do dental implants cost? I recently made a video about cost of implants. If you have not seen the video, I will leave a link in the description below. As you may know, dentistry perceived different by different people. On one side, we have one extreme. People who will never step a foot to a dental office unless they have extreme pain. On the other side, we have people who are eager to go every 6 months for their cleaning appointments and they all pumped about it. Majority of people, however, fall somewhere in between. In this video, we will not talk about any extremes and we will focus on the averages. So if you are an average individual that perceives dentistry as valuable, however not too thrilled about having a dental work done, here are some factors and tips to consider of whether or not you will be in pain after dental implant surgery. Number 1. Biggest factor being, what's your individual pain threshold? Are you jumping out of the dental chair the moment topical gel touches your gums? Or you are the type of individual who asks the dentist not to get numb for those 2 fillings that needs to be done? Continuing forward, we are going to focus on individuals with an average pain threshold. So second factor, how many implants are you getting? Despite what people say, getting 1 implant into healed bone is much easier, faster, and less invasive than getting 4 implants after extracting some teeth on top of that. So size and extent of the surgery does play a major role in post-operative pain expectations. Third factor, how much time does it take to do the surgery? I have done dental implant placements in the past under half an hour, from start to finish in the slam dunk cases while being well prepared ahead of time. If you get same implant placed in 2 hours, that will generally hurt more than surgery that takes only 30 minutes. If you get half a day surgery, like in teeth in a day concept or all in 4, your pain expectations should be much higher. Remember, the more time it takes to do a surgery, the more likely you will experience post-operative pain. Fourth factor, what's the condition of the gums and the bone for the implant? If you haven't been missing a tooth for many years, your implant dentist may need to do additional surgeries in order to develop a proper implant site, even prior to the actual implant placement, or to do auxiliary surgery during actual implant placement procedure. As you now know, the more surgeries you have to do, the more likely it's to hurt afterwards. Factor number 5. Will the dentist freehand the surgery or do a computer-guided surgery? There are gurus in the field who can place 6 to 8 parallel implants in a single arch by just eyeballing it, and they will have a great outcome after the surgery. However, most of the dentists cannot replicate that accuracy and superb precision, and using guides or stents in cases that involve placement of more than 2 implants is a no-brainer to me. In certain cases, guided surgery allows us to do a less invasive surgery with a quicker overall process. The other thing about freehanding bigger cases is that oftentimes, unintentionally, the implant may not go into the right trajectory and potentially cause complications, including post-operative pain. And last factor that affects level of pain is, what are you going to do after implant surgery? Following carefully all of the post-operative instructions provided by your implant dentist are essential and critical in order to minimize post-operative pain and discomfort and to maximize proper healing. In my practice, we practice what we preach. We always try to do minimal invasive surgery if possible. We always try to utilize custom fabricated and 3D printed surgical guides right here in the Lux Dentistry Clinic for any cases involving multiple implants, in order to minimize surgery time and to maximize proper placement in the right location with the right angulation. And of course, your anticipated pain will be managed with the proper medications. Remember, it's always best to measure 7 times before making a single cut. I hope you enjoyed this episode. Don't forget to smash the like button, to subscribe to the channel. Thank you for watching until the end. I wish you lots of luck and health.